government assistance programs are ideally a way to help people become more self-sufficient. But for many working families, the path to self-sufficiency can also have financial stumbling blocks, especially when a new job or a pay raise leads to a drop in benefits, known as the cliff effect. One effort to stabilize the path is a program offered by Metro Housing Boston, with the help of $1 million over 3 years from Beth Israel Deaconess Medical Center. To tell us about the program is Metro Housing Deputy Director Susan Nohl. Thank you very much for being with us, Sue.
Hi, Chris. Thanks for having me. It's great to be here.
Well, good to see you again as well. So I want to talk about the cliff effect. I mean, it might be reasonable for government assistance to be readjusted as circumstances change, but when you say cliff effect, that seems to be disruptive. I mean, how bad can it be?
So in this instance, what's happening is that as a household or a family that's participating in our leased housing program is moving from benefit income to income from wages. They may have gone through a training program, they may have participated in an education program, and now they're at a point where they're obtaining a job where that pays wages. Well, while they're in this training program or education program, their benefits typically cover, some cash assistance, possibly their health insurance. They may be eligible for food stamps. They may be eligible for a deeper rental subsidy because their rent calculation is based on 30% of the actual cash benefit that they're entitled to. And as families transition to work, as most of us know who work, we see our paycheck and we have one amount, which is our gross amount. And then we pay for things like taxes and Social Security deductions. Families may be transitioning off of Mass Health or another public insurance onto paying their own because their employer pays for that. They may have to pay childcare expenses that previously they may have had at a subsidized or reduced cost. And all of those things play into the fact that the family, although they see a higher gross amount than they're typically than they had been typically receiving, once you add in all those deductions and take away the benefits they were getting, that's kind of the cliff effect, right? So now they're not dealing with necessarily as much income as they had hoped they were getting, or that they were even getting possibly when they were receiving cash benefits, because a lot of these other requirements to pay in terms of health insurance and childcare were covered by another benefit. So
well, of course, it's just even a modest step forward can lead to a big step backward. Of course, I imagine in the mind of a family, they might also be disincentivized from taking that step forward.
Well, I think, Chris, that I've done this work for a long time, and I've talked to a number of families where they're really motivated. They want to make a difference. They're finally at a point in their life where they have access to an education program or a job training program. They've completed it. They're really excited about getting in the workforce. They come to us to report their income, and they're very proud of the fact that they're working. And then we do their rent calculation, and you can see kind of the despair and the concern on their face that they didn't realize how high their rent share was actually going to go. And then they're looking to us for clarification, because they're saying, well, what you're basing my tenant rent share on, again, gross income, is not what I'm seeing when I go and cash my check or have my check direct deposited into my account. So how is this that it's better for me, right? Especially then as you see families, even though we give a deduction for childcare expenses, that deduction doesn't necessarily match the benefit they were getting if they were on reduced or free childcare while they're in their training program. So they're seeing other expenses that they weren't necessarily prepared to have it impact their kind of household financial situation the way it does. And again, the program is designed to really make sure that families the participants are paying 30% of their income towards their rent and utilities. That's kind of the standard for affordability. We support that standard for affordability. This program, though, allows us to use net income for households who are going to participate in this pilot versus gross income, because that's the actual income that they see. And it's more realistic, and it's going to be easier for them to kind of budget and predict what their rent will be, because they'll see that it's actually on the income I'm taking home, not on my income that then somebody takes a whole bunch of it and I end up with a little bit of it.
I noticed the main financial backing for this initiative is a healthcare provider group. Now, this is the kind of thing that might be encouraged by regulators, but aside from that, why is this so much a health concern?
Because it's been really interesting working in this field over the last several years, where affordable housing and housing stability has really become the focus of a lot of efforts across other disciplines. And it's been great to have our healthcare partners recognize that stable housing really does contribute to better health outcomes. You know, I've worked on a number of projects over the years where we've looked at families and individuals who were homeless, and once they were housed, what does that do? There's been a lot of efforts, there's been a lot of studies, there's been a lot of great research, and it's now like it's progressing. So now we don't want folks to have to be homeless for housing stability and health outcomes to be tied together. And we want to be able to help families who may be in an unstable housing situation, or even if they're in a stable housing situation, increase their level of stability. And does that have positive outcomes on healthcare results for either household members, children, other members of their family, even if they don't live with them? So, you know, if my elderly mom, who I may be able to support a little bit more, can stay in her housing, like, does that have an effect? So it's a much broader approach to housing stability and the impact on healthcare. And we were so excited that Beth Israel Deaconess embraced our concept. It was, you know, one of those, this was one of those ideas that we were sitting around one day having a conversation about, if you could do anything with the program, what would it be? I threw out this idea with a group of folks that I've worked with for a long time. Our development team kind of shaped it and came back and asked some questions. And then Beth Israel really bought into our idea of helping families in a day-to-day basis, like on the ground level, giving back to them, investing in them. And does that have an impact on not only how they feel about their housing stability, but possibly their long-term health outcomes? So it's been great working with the healthcare providers. We've worked with Beth Israel. We've worked with some folks at other, you know, we live in Boston. We work in the best place in the world for healthcare facilities. So I'm excited about where the future is for us as we move forward with partnerships similar to Beth Israel. But this one's a big one.
Most of the money is going to the households, not as a dedicated rent check, but basically as, you know, it's up to you to decide how to use this. But why do it that way?
So because we're working with families who are participants in our federally funded Section 8 program, we're still required to administer the program the way the federal government requires us to. We benefit from the fact that we're a moving to work organization, so we have some flexibility on what we can do. So these families are, well, you know, we'll still administer the program the way we are required to, but we'll do an additional rent calculation that will give them a payment each month from Metro Housing using these funds. And the goal being to encourage them to use that money to help them increase their level of stability or their level of comfort in their housing situation. So we're not prescribing what has to happen with it. It's not well, we'll put it in a savings account for you, and if you do all these things, in a few years, you might get this money. It's real money that these families are going to see in real time. They'll be able to possibly, you know, stay on budget with utility payments, or, you know, the pandemic has impacted a lot of households in ways that, you know, we'll see for years. Is this money that will help them with that? Are they able to pay down debt? Are they able to start a savings account? Are they able to, you know, do things for their children that maybe they can't do right now because they don't have that extra income? And it really was designed to be, you know, we want to encourage you to continue to increase your employment, whether that be through a raise or a promotion. We don't want anything to hold you back. If you want to work, we want to encourage you to do that. And we don't want to prescribe to you how you use this money. We want it to be something where you make the choice as a participant as to how this is going to help my situation as a family. And we're working with some great researchers, and we're hoping that the families that participate will be honest with us and share their experiences and how their comfort level either improved or didn't, or where they spent it. And that'll give us some insight into possible changes programmatically on a much bigger scale than the couple hundred families that we're going to be able to assist with this project.
By the way, this is a program I would expect maybe when the economy is going strong and a lot of people are moving up or finding better things. We're not in that situation right now. Does that give you any maybe cause for concern?
I think one of the things that this has showed us, this pandemic and some of our experiences, where we really braced early on for, a tsunami of families who may have been impacted by the loss of jobs. And I'm not saying that we didn't see that. And we've had some families that, or participants that have definitely been impacted. But a lot of the families that we're working with are families in those essential jobs. And a lot of them have been working extra hours, doing, whether they're in the healthcare profession and now they're picking up extra shifts to work at a vaccine clinic, or they were, grocery or restaurant workers who took extra shifts in order to make sure, like when their coworkers were ill or when they needed extra time. So I think we still have, a significant number of participants who have income from wages, that they're in work, in jobs and in occupations that have not been as impacted by the pandemic. So in a way, it's nice to be able to encourage them and motivate them to continue working and to continue to be able to do all that they've done without it necessarily turning into a penalty for them. Now, we have had families that have been impacted, and our goal would be that anybody who wants to work, we will, we'll work. We have a number of great partners in the employment and training programs in our region that, we want to help them. So if folks are ready to work and return to work, we can help make those connections. So I'm not as worried as I might have been, when this all started.
Finally, Susan, if people want more information either about this initiative or any other way that Metro Housing Boston can help, is there a place where they can find that?
So I always encourage anybody who wants to learn more about Metro Housing, and we administer a variety of great programs that help with housing stability from homelessness to home ownership across the spectrum, to check out our website, which is www.metrohousingboston.org. And there's information on there about all of our programs. There's some information about some of the success stories that we've had. There's contact information for key staff. So that would be the best way for folks to reach out to us. The other is they could call our main phone number if they don't have access to the internet, and that's 617-859-0400. And that's, answered during regular business hours, Monday through Friday, 8:45 to 5. So those would be the two best ways for folks to reach us right now.
Well, thank you very much for taking the time to join us.
Thank you, Chris. Good. Have a great day.
Yes, you too. That was Susan Nohl from Metro Housing Boston.